Joining us today is Sayed Ahmed, PhD candidate. Now, he's working in a number of high-risk foot clinics in the Sydney hospitals as part of an interdisciplinary team. Now, the hospital is involved with St Vincent's, APM, War Memorial Hospital, and he's also in private practice at Foot Balance Technologies, his own private practice. His PhD is in the domain of pedorthics, researching footwear and orthosis, the prescribing design parameters of offloading neuropathic plantar forefoot ulcers, and the prevention of. And we know how important prevention of ulcers is. Sayed, thank you so much for joining us. What's been the main focus of your research so far?
Thank you, David. As we know that increased plantar pressure is one of the major influencers in causing neuropathic ulcers, and above 70% of these ulcers happen at the forefoot. So my research main focus has been to find a parameters for footwear and foot orthosis, how to reduce this peak plantar pressure, and in this population also how to increase the adherence in this population by personalizing the footwear and foot orthosis, and that also increased their adherence.
And
Thank you.
what has been the design features of the footwear and orthosis that give you the greatest peak pressure reductions?
So it has two aspects. The first aspect is the footwear design. For example, obviously the optimum fitting is the key. Then it comes about the footwear design, such as upper design, upper height, upper materials and lining materials, heel height, toe spring, sole profile, such as rigidity of the sole, rocker profile of the sole that includes rocker apex position, rocker angle, apex angle, and such. And when it comes about foot orthosis, the casting method and the materials combination, the shape of the orthotics, that plays an important role.
Yeah.
On top of this, the positioning and using a metatarsal dome, metatarsal pad, or metatarsal bar also influence the plantar pressure. And sometimes removing the hard materials from under some bony prominences, and also cushioning with soft materials has good influence on plantar pressure reduction.
Now, when you talk about upper height, so are you suggesting that an ankle boot is going to give us a better reduction in peak pressures in the forefoot when we go to an ankle boot?
Certainly, in evidence and also in our clinical practice, it is proven that especially when for reducing peak plantar pressure at the forefoot, ankle boot or above the ankle boot has a greater influence in reducing peak plantar pressure.
And so, what design parameters are going to give us the best reduction in those peak pressures?
So, having an ankle boot with a lower, relatively lower heel height and a more increased contact with the ground kind of sole design, and foot orthosis design with the semi-weight bearing casting, and possibly digitally modifying the cast to increase the MLA, and cushioning the bony prominence area, and having the rocker profile, so that our target area can be offloaded nicely, not influencing the balance of the patient negatively, will ideally give, and a good fastening system either with the lace or velcro in combination with the zipper works pretty well for reducing the peak plantar pressure.
And so, what have been the biggest challenges in reducing those peak pressures?
So the biggest challenge is to finding the fine line between what the patient can tolerate, they can accept, and they can afford. When we compare with the ideal recommendation for footwear parameters, and then the second challenge is some confronting comorbidities in the patient, that if we want to implement one, then another factor becomes challenging. So for example, if it is a tight calf muscle and has a forefoot pathology, we want to reduce plantar pressure at the forefoot. So um, if we changing the rocker profile, or if we are changing the heel height, that can cause some discomfort to the patient. At the same time, if we want to influence the plantar pressure reduction a lot more, that can be a little bit more uncomfortable for the patient, and that may affect the adherence. So this kind of scenario becomes a bit challenging.
Very good. All right, so what's going to be the next thing we see coming out of your research?
So, as you know, currently I am conducting a multi-site N-of-1 trial in some of the major hospitals in New South Wales, and I'm finding some and exploring some parameters that for footwear design and orthosis design that can reduce uh, peak plantar pressure in those population, and with cases the device needs to be personalized for those patients. And ultimate goal is to recommend an algorithm that has personalized recommendation for those population that can increase adherence also, to
Very good.
get our actually achieve our goal to reduce the number of avoidable amputation rate in this population.
Yeah, great. All right, so if any of you would like to have some one-on-one time with Sayed or any of our other panel experts, please go onto our website, advancedpressuremapping.com.au. We'll be at the DFA Congress. That's part of our virtual booth. Sayed, thank you very much for your time. Thanks for joining us. We'll look forward to seeing you then.
Thank you, David.